Bogside Brandywell Health Forum is a community healthy living centre. We're based in Derry City. We're the largest healthy living centre across the north of Ireland. We provide programmes for all age groups. It can be physical health, mental health, nutrition, stop smoking services. We have partnerships with statutory organisations, community organisations. We're at the tables where it's most important to be.
The legacy of the Troubles and the issues that we had going on when the Troubles were here, that has fallen over into today. Of the 40 most deprived areas of practices within Northern Ireland, Derry has 11 of them.
What we're trying to do now is address some of the long-term coping strategies that people had developed over the years. There is approximately 70 programmes that's running. We are the lead organisation for the Spring Social Prescribing Project. We receive referrals from GPs and health professionals.
What we try and do is ensure that the patient remains at the centre of all this. So having the Spring Project there gives us an opportunity to allow them to become not a patient anymore, but a member of the community that's been helped through local community services.
My first contact was through a therapist who did cognitive behavioural therapy. So having someone at the end of the phone or on a screen and someone who actually wanted to help, it was a lifeline.
We have seen GP appointments reduced. 87% of those involved in the project have increased health and wellbeing. We are delighted that a £3 million project that ran for 3 years that came from the Bogside Brandywell Health Forum is now being delivered in 20 other organisations across the north of Ireland and Scotland. And the overwhelming success of that has now seen us secure another £1.5 million for another 2-year rollout of the project. The FACT project is Families Achieving Change Together. It's a family support project that's run in partnership with 2 post-primary schools in the area.
It works with all children from 11 to 18, but it delivers large-scale programmes, but also bespoke one-to-one programmes for children who are having difficulties and need that extra little bit of support. But as well as that, the Well Connected group was formed and the health champions.
The ideas that they were coming with was a lot better than the ideas that we had. So we thought, let's get them qualified to be able to deliver services for their peer groups. We have a homegrown band that has come from our health champions, playing for different organisations and being involved in the local community.
Just being able to talk to other people my age and be able to understand what they're all going through, I've gained a lot from that.
Older people help design our older people programmes. We would ask them what they want to do.
We get involved with gentle exercise. We have a dance once a month and we have then tea and sandwiches.
For people with long-term conditions, we have our trained specialists that provide one-to-one programmes for 12 weeks.
I had a back problem which made life very difficult for a long period of time. I was introduced to Doctor's Referral programme where people like me would come along and try out exercise, see how it would work. And for me, it was a revelation.
We provide a Saturday cycle club for adults, family cycles and young people cycles as well.
Cycling gets me out and doing a bit of physical exercise, which really helps me, and that social aspect helps me mental health. If I'm struggling with something, I'll be able to talk to people out there as well.
It's great to see them cycle past the River Foyle every Saturday morning at 10 o'clock.
This is like a big family to me. The people here will look after you.
I'm looking forward to get back to the club and get dancing. I love dancing. I'm a dancer marathon.